Imagine I gave you $1 and asked you to buy me a soda with that dollar. Then later on, I asked for you to buy me a candy bar with that dollar that you've already spent. This is an impossible scenario, right? Well, apparently it isn't if you're the government. You see, the healthcare bill of 2010 was said to provide two major benefits. First, the bill promised to find savings in the government's biggest health insurance program, Medicare, and use those savings to reduce our deficit. Second, the bill promised to expand healthcare coverage to uninsured Americans. Sounds pretty good, right? But how does the government propose to pay for both benefits? Here's where the math becomes fuzzy. In our paychecks, we each pay taxes that go to the Medicare Trust Fund. What is the Medicare Trust Fund? It is similar to a savings account you'd have at the bank. But instead of only one person contributing to the account, all of us taxpayers do. The savings, or taxpayer dollars, in this account are then used to pay out benefits to other Americans enrolled in Medicare. But this trust fund has been nearly sucked dry and was scheduled to be empty by 2016, leaving millions of Americans down and out when it came to their health benefits. So the healthcare bill of 2010 promised to use the bill's savings to extend a lifeline to Medicare, ensuring it can pay full benefits to beneficiaries until 2024. If our taxes only went to shoring up Medicare, that'd be one thing. But remember that other promise from the healthcare bill? Expanding healthcare coverage to more Americans? Here's where the real problem comes into play. The government also promised to finance new healthcare benefits with these exact same savings. So which is it? Making Medicare whole again, or financing new healthcare benefits? The law doesn't produce enough money to pay for both. According to the government, it is in fact both. In short, the government is counting these tax dollars twice to finance both benefits. But this simply doesn't add up. It doesn't take a mathematician to know that $1 doesn't magically turn into $2 when it passes through government hands. What does this mean for you and me? It means we're going to have to borrow more money to pay for some of the key promises of the healthcare bill. With our deficit already soaring out of control, this doesn't seem like a good idea. And our greatest generation and the baby boomers' Medicare benefits aren't looking so secure anymore. Those Medicare savings will be tapped to pay new beneficiaries. Creative government accounting will catch up with us, and you and I will pay more in taxes to finance these programs. In the end, double counting only doubles the crisis.
As part of healthcare reform, all individual plans have to cover 10 essential health benefits.
Yes, I remember that.
Their purpose is to make sure that no matter which plan or which insurance company you choose, you get basic coverage for day-to-day sickness, chronic conditions, and major surgery.
All right, and remind me, what are the 10 benefits?
Well, there's ambulatory patient services.
And what's that, outpatient stuff?
Yeah, outpatient services, procedures, tests, that sort of thing.
Good, got it.
Then there's emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment.
Okay, that's 5.
Prescription drugs.
6.
Rehabilitative services and devices. In other words, something you might need short-term while you recover from an injury.
Uh-huh.
Lab services, preventive and wellness services, and chronic disease management.
And number 10?
Number 10 is pediatric services, including oral and vision care for anyone up to age 19.
Okay, that's a pretty solid list.
All plans also have to limit how much you pay out of pocket during the year.
To how much?
For individuals, the upper limit is $6,350. For families, it can't be more than $12,700.
That seems kind of high, doesn't it?
But that's the worst case scenario, the most anyone could possibly pay. For most people, it'll be lower than that, maybe a lot lower, and all of your out-of-pocket expenses are applied to this amount.
Which means what? Deductibles? Co-pays?
That means your deductibles, your co-pays, co-insurance, even your drug co-pays, they all apply to that total.
Okay, so no matter what, your out-of-pocket expenses are capped.
Yes, and anything over that amount is 100% covered by your insurance.
All right then.
For more information, visit us online at www.ncreform101.com.